Most people hear the word adenovirus and immediately assume it's just another harmless cold virus, something you catch, suffer through for a few days, and forget about. But the uncomfortable truth is that adenovirus is one of the most underestimated viral infections in modern medicine, responsible for widespread outbreaks, severe complications, and even preventable deaths, largely because its symptoms are so familiar that they blend into the background of everyday illness. And that is exactly why understanding adenovirus matters, because this single family of viruses can quietly infect your lungs, eyes, gut, bladder, and in rare cases, your heart and brain, all while disguising itself as something mild and routine. Adenovirus is not one virus, but a large group of more than 50 known human types, each with different preferences for different organs, which explains why one person may develop a sore throat and fever, another painful red eyes, another severe diarrhea, and another pneumonia requiring hospitalization, even though all of them are infected by the same viral family. Structurally, adenovirus is a non-enveloped DNA virus, a detail that sounds academic but has real-world consequences, because lacking an outer lipid envelope makes it extraordinarily resistant to drying, heat, detergents, and alcohol-based hand sanitizers, allowing it to survive on surfaces for days or even weeks, which is why it spreads so efficiently in schools, daycare centers, hospitals, dormitories, nursing homes, gyms, and military barracks, and why outbreaks often seem to appear suddenly and spree rapidly before anyone realizes what is happening. Transmission occurs through respiratory droplets from coughing or sneezing, direct contact with contaminated hands or objects followed by touching the eyes, nose, or mouth, through the fecal-oral route due to inadequate hand hygiene, and through contaminated water, particularly swimming pools with insufficient chlorine, which is why adenovirus has long been associated with outbreaks of conjunctivitis and pharyngitis linked to public pools. Once adenovirus enters the body, it attaches to epithelial cells lining the respiratory tract, gastrointestinal system, urinary tract, and conjunctiva, forcing these cells to produce new viral particles until the cells rupture, triggering inflammation and immune activation, which is what produces the symptoms people feel, ranging from mild discomfort to life-threatening disease depending on viral type and host immunity. In otherwise healthy adults, adenovirus infection often begins with non-specific symptoms such as fever, sore throat, runny or blocked nose, cough, headache, muscle aches, and profound fatigue, symptoms that closely mimic the common cold or influenza, leading many people to self-manage without medical advice while continuing normal activities, unknowingly spreading the virus to family members, co-workers, classmates, and vulnerable individuals. However, adenovirus frequently progresses beyond the upper respiratory tract, causing tonsillitis with severe throat pain, bronchitis with persistent coughing, and pneumonia, characterized by shortness of breath, chest tightness, low oxygen levels, and abnormal chest imaging, a form of viral pneumonia that can be particularly severe in smokers, older adults, and those with chronic lung or heart disease. One of the most distinctive presentations of adenovirus is viral conjunctivitis, often bilateral, producing intensely red, watery, gritty, painful eyes with light sensitivity and blurred vision, a condition that is extremely contagious and capable of shutting down schools, workplaces, and clinics due to rapid spread. Adenovirus is also a significant cause of viral gastroenteritis, particularly in children, leading to vomiting, watery diarrhea, abdominal cramps, fever, and dehydration, which can quickly become dangerous in infants and young children if fluid intake is inadequate. Another lesser-known but important manifestation is adenoviral hemorrhagic cystitis, especially in children, which presents with painful urination, urinary frequency, and visible blood in the urine, a frightening symptom that often leads families to emergency departments. While most infections are self-limiting, adenovirus can occasionally invade the bloodstream and spread to multiple organs, causing encephalitis with seizures and altered consciousness, myocarditis with chest pain and heart rhythm disturbances, or disseminated infection in immunocompromised individuals, including organ transplant recipients, chemotherapy patients, people with advanced HIV infection, and those taking long-term immunosuppressive medications, where mortality rates can be high if diagnosis and supportive care are delayed. Children are disproportionately affected by adenovirus because their immune systems are still developing and because close contact environments such as schools and daycare centers facilitate transmission, making adenovirus one of the most common causes of pediatric respiratory illness worldwide, while adults may experience milder disease yet still suffer complications or act as silent carriers. Diagnosis of adenovirus is often clinical during outbreaks, but confirmation may be achieved using PCR testing, antigen detection, or viral cultures from respiratory swabs, stool samples, urine, or eye secretions, particularly in hospitalized patients where identifying the cause influences infection control measures and prevents further spread. One of the most frustrating aspects of adenovirus infection for both patients and clinicians is the absence of a widely available specific antiviral treatment for routine cases, meaning management is primarily supportive, focusing on hydration, rest, fever control, pain relief, oxygen therapy when needed, and close monitoring for complications. While antibiotics offer no benefit against the virus and should be avoided unless there is clear evidence of secondary bacterial infection. Although certain antiviral agents like cidofovir may be used in severe cases in immunocompromised patients under specialist care, they are not a solution for the general population, reinforcing the importance of prevention and early recognition. Most adenovirus infections resolve within 1 to 2 weeks, but there are clear warning signs that should never be ignored, including persistent high fever beyond 3 days, rapid or labored breathing, chest pain, bluish discoloration of lips or fingertips, confusion or reduced alertness, severe dehydration, inability to tolerate fluids, blood in urine or stool, severe eye pain or changes in vision, or symptoms that worsen rather than gradually improve, as these indicate complications requiring urgent medical evaluation. Prevention remains the most powerful weapon against adenovirus and begins with simple but effective measures such as thorough hand washing with soap and water, particularly after bathroom use and before eating, avoiding touching the face with unwashed hands, disinfecting frequently touched surfaces, staying home when ill, not sharing towels, utensils, or eye cosmetics, practicing proper respiratory hygiene, and ensuring swimming pools are adequately chlorinated, while healthcare and institutional settings must implement strict infection control protocols to prevent outbreaks. Although a live oral adenovirus vaccine exists, it is currently restricted to military use in certain countries and is not available to the general public, leaving community awareness and hygiene as the primary defenses. Understanding adenovirus is essential because it challenges the dangerous assumption that familiar symptoms are always harmless, reminding us that viral infections can escalate quickly in the wrong circumstances and that early recognition saves lives even when specific treatments are limited. If you or someone you care for develop symptoms that are severe, persistent, unusual, or rapidly worsening, do not dismiss them as just a virus. Seek medical advice promptly, and if you found this in-depth, evidence-based explanation helpful and want more clear, honest medical content that cuts through misinformation, make sure to subscribe to the MedLogic channel, turn on notifications, and join us for more videos that help you recognize warning signs early and make smarter decisions about your health.